Y ahora vamos a tener una conferencia también muy interesante con dos personas que yo respeto y admiro mucho. Voy a presentar primero a un líder puertorriqueño que se ha dado a conocer en el otro lado del mar, en otras ciudades de Estados Unidos, pero aquí en Puerto Rico está despuntando como un líder de lo que es la industria médica en Puerto Rico. Es una persona que va a la vanguardia de todo lo que tiene que ver la industria de la salud. Él es radiólogo vascular y hace mil cosas. Se está convirtiendo próximamente, va a ser abogado también, pero es una persona que conocí hace 8 años y hoy día estoy muy orgulloso de quién es hoy. Aquí está el doctor Leonardo Valentín. Y con él está Sofio. Sofio trabaja para el Departamento de Salud Federal. Él es un Special Assistant, un asistente especial del secretario de Salud. Estuvo trabajando con los centros de CMS y ahora trabaja en HHS. Sofio, come to the stage. Y ahora, esta conferencia, vamos a estar hablando sobre el futuro de la salud en Puerto Rico, Latinoamérica y en Estados Unidos.
Bueno, gracias por esa introducción. Me siento igualmente honrado de estar en este grupo de personas selectas. Algunos que conocí a través de los medios, los conocí aquí, así que siempre es un honor. Ahora, para presentar a nuestro invitado especial, Noah, pues vamos a cambiar un poquito de inglés y hablar un poco sobre la salud y sobre unas cosas interesantes que él nos tiene que mencionar. So Noah, welcome to Puerto Rico.
Thank you very much.
It's a great honor to have you here. Evidently, as a young person involved in the MAHA movement and this administration, and you can see we have a great crowd of a lot of young people too, so that's exciting. What would you say the administration is doing to help young people become healthier and understand the philosophy or the message for MAHA?
It's a great question. But before we get started here, I just want to ask for another round of applause for Tony. He's done a great job organizing this. Tony's a builder. He makes ideas happen. So thank you, Tony, for having us. Now, Leo, to answer your question, I think it comes down to a simple truth. America is a great nation, but for too long, our healthcare outcomes have fallen well short of our greatness. And this very basic truth has been quietly known to millions of Americans across this country in their kitchens, in their living rooms, and together they formed the MAHA movement. And they brought this simple truth back into the spotlight, back into the political arena, and is forcing us to confront this fact as an administration. Now, Leo, you asked about young people specifically, and nutrition is important. But young people have a problem beyond nutrition, and yes, young people have been fed poison for decades, but when my own organization, HHS, is coming out with statistics like 1 in 10 young people have attempted suicide, or 1 in 6 young people have contemplated suicide, the problem's a little bit more than just nutrition. It's a spiritual problem from which all other problems arise. But it's also a very real material problem, where young people are looking to the future and they see bleakness. They do not believe that they can afford the life, the American dream, as it was promised to past generations. And let's address the elephant in the room. We spend trillions of dollars on social programs that are subsidized by young people working hard and putting their money into them, and they believe that they will never receive a dime on the back end of that. That's why we're working so hard. And on top of that, when young people see waste, fraud, and abuse on such a rampant scale, it pisses them off to high heaven. I know it pisses me off. So that's why as an administration, we're working to build a life for young people that they can afford, that they can enjoy, a brighter tomorrow than the past, and a brighter tomorrow than the tomorrow they think they will inherit today. We're not just fighting for nutrition, we're fighting for the future.
I love that. I love that message, especially because we think about healthcare, and obviously we have to address our chronic condition, our elderly, but healthcare is everyone, right? And I tell people, good nutrition, the lifestyle, the mentality, is not just conservative values. These are good American values that we're trying to preserve, and that's what's conservative about the conservative movement. We want to preserve values that make us great, values that make us healthy. So that's why I love that answer so much. changing gears a little bit and thinking about MAHA, the administration, beyond nutrition, I think one aspect that unites a lot of people, I can say it's a bipartisan issue in terms of pharmaceuticals and drug prices. And I think it's something that we've seen a lot of positive messages and comments from people from all parties. And so I think it's important to emphasize what we're doing with Trump RX and talking a little bit about the legal background. There's this concept called most favored nations. And so we've been always wanting to have that leverage to get better prices for our patients and making sure we have more accessible drugs and medicines. So I think that aspect is really important to emphasize. What is the administration doing, how Trump RX came about, and who has been involved there?
Great questions. Well, first, when the president calls you and says, hey, we need to cut drug prices by 90%, there's two ways you can respond to that. First, oh, Mr. President, I'm sorry, that's never been done. I don't think we can do that. That's a huge ask. These pharma companies are very powerful. Or you can go the second route, which is, yes, sir, Mr. President, we'll get it done. And can you guess what kind of men Secretary Kennedy, Dr. Oz, and Chris Klomp are? They're the second ones. So I can now walk you through MFN. We can talk through the website as well. And I spoke about young people. And young people were very involved in this process and very involved in Trump RX. So which way we want to go, MFN or Trump RX?
Let's start with MFN,
Okay.
and then we get into the technical details of how we made it happen.
Absolutely. MFN is about fairness. It's very similar to NATO, where we said, well, the president said, wait a minute, we are spending all of the money, the majority of the money, researching and developing the drugs used throughout the world, and then also we're charging our people way more money for the same drug. So all the profits are being made here, and all of the work to do the drugs are being done here. And yet we're getting screwed, the American consumer is kind of getting screwed over on the back end of this. So he said, all right, why is this happening? We need to do the following. We need to go to other countries across the world, and we need to renegotiate these deals, specifically with Europe. And we're going to sit down with these countries, and we're going to say, hey, the deal has changed. It's a new deal now. You're not going to negotiate with a company. It's country against a country, a balanced scale. And guess what? America wins. We're heavier on that scale. So we are raising drug prices in different countries, and we are lowering drug prices here in the United States so that the American consumer can reap the benefit of their own tax dollars, their own economic horsepower going to work in building these, in many cases, life-saving drugs.
No, I wanted to add to that. When we talk about free market, this is exactly the principle we need. In a free market, you need competition, and what we were not having is that fair competition. So we're creating a level playing field, and their prices are going to become the real prices. The way it was before, we were subsidizing and creating lower prices in other jurisdictions. Now we're going to get the real price, and it's going to be fair for everyone because we're going to be paying what they're worth, and everyone is in a level playing field. So I agree wholeheartedly with that. Now, in terms of the technical part, I know there are a lot of young people involved, the technical part, the informatics. What can you tell us about that?
Well, you're right. There were young people involved, but more remarkably, there actually weren't as many as you might think. It was a very, very small team. We didn't use outside vendors. It was a team of maybe 5 to 10 people from HHS. It was myself, a gal named Inma Hernandez, a great drug pricing expert, Rujal Desai, incredible lawyer. And then we had the National Design Studio, which is Joe Jebbia, who's the founder of Airbnb, his team. And they're building awesome websites for the government. And the leader of that team was a 19-year-old engineer named Big Balls. You may have heard him. He's a Doge engineer. And so Big Balls, along with 2 of his other engineers, helped build this website. It would have cost billions of dollars, taken a year to do. They did it in months for whatever Big Balls is being paid. I don't even know if he's being paid at all. Maybe he's doing it for the love of the game. But that was a perfect example of how this administration trusts young people to get the job done on the highest scale. And boy, they absolutely crushed it. In my humble opinion, I think the website looks fabulous. You can go on it today and find your prescription drugs for cheaper that we worked hard to negotiate through most favored nation drug pricing.
And it actually works really well. I was using it the other day, and I was really impressed by what you guys deliver with a small team and in record amount of time. And you can compare that to the old Obamacare rollout and what disaster that was, right? So I think it is good to have talented people, young people involved. And on that note, you've seen the message that we're trying to deliver and to make sure the young people are listening to. But from your perspective, what would be your advice, seeing you as yourself being a young person in the administration, seeing other talented teams being involved, achieving significant results for the country? What would be your advice for that generation and that young generation that's joining not only the conservative movement, but joining the more active political life, perhaps?
It's a great question. My advice would be, for young people watching, be like big balls. Say that one more time. Be like big balls. 19, he recently turned 20-year-old engineer leading the National Design Studio engineering team. The president knows who he is. Stephen Miller knows who he is. Many important people know who he is, and he does great work. He's very good at what he does, but what I'd say is he's probably not the best in the nation. There's other people who do what he does, but there's somewhere way deep in an org chart at Facebook, right? Big Ball's very wise, his name's Ed, by the way. Ed very wisely found a place where his skills are invaluable, but also where he works with a man who is willing to lift him up and showcase him to the world and invest in his development. Joe Gebbia is already a very successful entrepreneur, famous, wealthy. He doesn't need more limelight. He's very happy to share it and mentor people under him. And the same goes for Dr. Oz, Secretary Kennedy, and Chris Klomp as well. So my advice to young people is the following. You have from the years 18 to 28 to get something done. After that, you're kind of in a managerial role, and you manage 18 to 28-year-olds while they do a lot of the grunt work. Everyone in the world is going to try to get a piece of those years. University tries to get a piece of that. Top corporations, Goldman Sachs, tries to get a piece of that because they know you're a workhorse during that time. They're going to try to harness all that energy that you have as a young man or young woman to advance their corporation. And then after you kind of burn out a little bit, they'll find another young person to take your spot and keep that machine churning. So to young people out there, I say, think of yourself. Who are you working for? If you're not working for yourself, which you should consider working for yourself, then are you working for someone like Joe Gebbia? So to young people out there, I say, be like big balls.
Excellent, good stuff there. And to change gears again, focusing more on the recent news, we've seen the department be very active, and I think this is really everyone's joining forces. Even the vice president is now involved in the waste, fraud, and abuse process. We saw some cases in California that what was happening with nursing homes, and I know we're going to be seeing perhaps more of those throughout the news. But tell us a little bit about your experience with what you guys are finding, and based on what you can share, what's looking ahead in terms of how we're fighting this war.
It's a great question. It's disgusting what we're finding across the board, big and small. There's some serious crimes you can't really mention, but there's criminality everywhere you look, and it degrades the trust in these systems. When you walk in the building at Hubert Humphrey, the headquarters of HHS, it says that this program was made for those at the dawn of life, those at the dusk of life, and those who live in the shadows. It uses light as a metaphor. But when everyone and anyone is able to take from these programs, that is literally taking from the most needy in our society. You're stealing from the poor, stealing from for whom the program was made, the widows and the orphans. It pisses me off to no end. And the things you see, whether you're taking homeless people off the street and stuffing them into home hospices so that you can charge CMS for that, or more sophisticated abuse that uses consultant on a massive scale, taking billions of dollars in a manner that the system was not made to fund, is harmful to the nation, it's harmful to the individual, and we're putting a stop to it wherever we go.
Yeah, I agree. And as a physician, I experience this from the other side, and the reality is sometimes I feel like we have the tools to make sure we're making people accountable for what they're doing, but unfortunately during other administrations there's not necessarily the political will to make it happen. So what happens is I feel like it goes through a lot of policy, additional policy, when perhaps we already had the tools to solve the problem. And so that policy really affects the providers because we're making the system more and more complex, adding regulatory layers. And so for us, it's really important that we're tackling these issues when they happen with the tools that we have, so we don't have to create a monster in a way to hide behind policy in order to be effective. So I think that's something great that we're seeing. And obviously, Puerto Rico being tied to the federal system, both from the Medicare part and also the Medicaid, we want to make sure we normalize everything in terms of our systems to make sure we have a similar process to the states. Recently, we're changing in Puerto Rico, the Medicaid system is changing to the APR DRGs. And this might sound, and it is a technical term, but the good news for all of us involved is that it really becomes more of a standard compared to the states. So now we're joining more than 25 states that are deploying the system, and we're standardizing things so that when a patient reaches the hospital, they're treated based on their condition, based on what they need, and we're able to compare cases, whether you're treated in Puerto Rico or you're treated in Florida. We're going to be able to have that data and continue to make the system better. So I think we're out of time. It's been a true pleasure to have you join us here. Thank you again to the organizers, to Tony and Gabriela, Latino Wall Street. It's really an amazing event, and thank you to everyone that has attended and enjoyed this great event with us.